Hello, I'm John Urbans, President and CEO of Greater Fort Wayne, Inc. Welcome to the Roadmap to a Healthy Reopening webinar series. Today, we'll be focusing on the consumer. Thank you to our partners, Parkview Health, Greater Fort Wayne, Inc., the Northeast Indiana Regional Partnership, and the Allen County Department of Health. 2 weeks ago, Governor Holcomb rolled out Back on Track Indiana. Allen County and all of Northeast Indiana entered Stage 2 on Monday, May 4th. That has helped clarify timing for reopening, but has created more questions on how to reopen. That has led us to offer an expanded series, and today, the team will help answer questions that have arisen for the general consumer. For housekeeping, we will be using the Q&A tab at the bottom of your screen. After the presentations, we will have a substantial amount of time for questions and answers to take place. Please hold off until we get to that time to enter those questions in that area. Following the webinar, you'll be receiving an email that contains a survey of the webinar, and then you'll receive a second email which will have a link to the recording and a copy of all the slides that are presented today. I want to thank participants for submitting questions in advance. They served as a guide for the Parkview team and the Department of Health team to develop the content. While you may not hear your specific question asked, we hope the information shared will address your most pressing concerns. At this time, I'd like to go ahead and introduce and turn it over to Dina Jackway, the Chief Community and Human Resources Officer for Parkview Health.
Great, thank you, John. So we're coming to you from our appropriately socially distanced webinar studio that we've been using here for the last couple of weeks. You're going to hear from a variety of presenters today, and so we're so glad that you're joining us. When we think about our community, we know that over the last 60 days, it has probably felt like one of our local CEOs put it, it's like you're flying a plane and you're trying to fix it at the same time. We know that as jobs have changed and schools have closed and digital learning became a reality, that many of our lives have been disrupted in some way or another because of what's going on. And as we begin to reopen, we felt as though it was really important to bring to you as a community the best ways and best practices to do so. But I really want to first start just by saying thank you. We have just been so humbled by the amazing and outpouring of the community and in our region for all of our Parkview co-workers. Whether it was thousands of meals being donated by local restaurants, or we had over 40,000 masks made by our community members and returned in our Make a Mask program. We have loved to see all of the cheering and the support that you've provided to us, and cannot say enough about how much that has meant, not only on my behalf, but the behalf of all 13,000 coworkers that we have here. So shifting a little bit into the current state from an Indiana focus, you may have seen this graphic before, but we feel like this graphic is a great way to depict Governor Holcomb's plan and what all of the stages look like. And while we're not going to go through each of these stages, you can absolutely jump on the website to see this. But I think a key component is just because the governor has said we're opening things up, doesn't mean we all flock back to doing things the way that we have done them before. And it doesn't mean that things aren't going to look a little different as you're engaging in restaurants or businesses. And all of the businesses that you interact with. And so we feel like it's important to say, you decide when you engage back into the community and how you want to engage. You have a lot of control over that and a lot of decisions that you can make, but you want to feel safe and you want to be safe and help protect yourself and your family. As we look at currently COVID-19 in our region, so kind of taking it from the state a little bit more regionally, we know that we're in what's called community spread. We know that there's no way to pinpoint the source. We know that it's not limited to one place or one area. It is now part of our day-to-day activities and routines. And I think the best way to describe it is it's going to continue that way, and it's going to continue to bring and evolve new best practices. If anything, we've known in the last 50, 60 days, things change very quickly. And whether you're watching local or national news or social media, you know that things are changing rapidly, and that will continue to happen. And so staying abreast of all of those best practices is important. important. Bringing a little closer to home, what's the state currently here at Parkview? And we want to be able to say that we're here to help and we're here to serve. And we're open for business. And we know that some have put off getting the much needed care that they have by not wanting to come into the emergency room or being afraid. And we want to be able to say, please do not put off care that you need to have taken care of. And please come, because our job is to help keep you safe and to keep the community safe. But know that we're watching things very carefully. From a healthcare system perspective, we are always monitoring whether it's the local data or the state data, national data. We're always keeping in mind what's happening and how we can bring those practices right here to all of our Parkview facilities in the region. And so because of that, we continue to have visitor restrictions. Because of that, we want to, again, this is all about your safety and the safety of our community. So we're going to restart services gradually. Best way for you to see what that looks like is by jumping on our website and being able to see from what's opening and what our current visitor restrictions are like. Because as those things begin to evolve and change, again, our practices of how to keep you safe will also evolve and change. We're planning for a future state. And we've been in that mode for the last 60 days. It's looking different every day, every week. So what we have in place today is likely going to change in a week from now in terms of what we're able to offer you and what we're able to open back up, and again, keeping you safe. But also from your perspective, understanding that what we're sharing today are common principles that you're going to be able to use not only in your workplaces as you go back to work, in public as you're interacting with any of the businesses that you're engaged in within the community. So really want to today focus on a few things. Our goals today, as you can see, is how you can thrive, how you can best protect yourself, how you can increase your understanding. There's so much technical knowledge out there. And again, if you've watched the news, you know there's so much material out there. Let's have us help you sift through some of that. And bring you some very practical ideas and answers. And gaining resources for ongoing support. Just as it's important for you to understand what you're going to see in the community, we need you to take care of yourself too. We all have to remember that as individuals, we're in this a little differently. And then getting your questions answered. As John mentioned earlier, we want to make sure that you have the opportunity. We have already received some questions from you that we'll answer, but as we have the live chat box open, you'll be able to ask the questions that you have. So I'd first like to turn it over to Dr. Ford, who is our Chief Safety and Quality Officer, to talk more about how to thrive in increasing your understanding.
Thank you, Dina. So first off, what do you do if you feel sick? You have symptoms, fever, shortness of breath, cough, and you're concerned that you might have COVID-19. So I just wanted to briefly cover the range of options that we have currently available if you have symptoms, you're ill, and you're concerned that you might need further medical assessment. So first of all, we have a toll-free line that you can call at any time and undergo a free screening. That's 1-877-PPG today. We also have posted an online Parkview symptom checker on the parkview.com website. And this will guide you through a simple series of questions to evaluate the symptoms that you may be experiencing, and then just help you determine what's the best way to seek further care and evaluation. We also have, for all of our patients that have established providers at Parkview Physicians Group, the opportunity to schedule or request a MyChart virtual visit. These are really wonderful things. We've gotten tremendous positive feedback from our patients with our expanded virtual health access. We are currently conducting over 6,000 virtual health visits every single week. And we've been really pleased with how this has been able to help serve the needs of our patients while keeping them safe and also helping them with being able to get the care that they need without having to come in person to a clinic visit. Finally, we have Parkview On Demand, and this is an app. And if you don't have an established Parkview provider, you can still be seen for a virtual health visit through the Parkview On Demand app on your smartphone or tablet. So I want to spend a bit of time talking about some of the different types of testing. There are two main types of testing that are currently available. First is the PCR nasal swab test. This is the one that you've probably heard and seen the most about. And basically a positive nasal swab test means that you have the virus that causes COVID-19. If you have a positive test, you should consult a provider and get instructions about managing your symptoms, how to self-isolate, what are the expected duration of symptoms, what are warning signs that would mean that you would need to go back to the doctor, or warning signs that may indicate that you might need to seek care at an emergency department. And the negative test would mean that no virus is detected at the time that nasal swab is collected. Important thing to note is that PCR testing just tells you if the virus is present at the time the specimen is collected. So a negative test on one day does not mean that someone is not going to get exposed to the virus or become sick at some point in the future. Next, there is the antibody test, which is a blood test. And the challenge with the antibody test is there are a lot of antibody tests being offered out there, but at this point, we really just can't develop helpful information for an individual person based on the results of the antibody test. It does play an important role in public health surveillance. So the Indiana State Department of Health has been working with the Indiana University Fairbanks School of Public Health, and they've been doing what's called a seroprevalence study. So they just released some preliminary results that we'll talk about in a little while, but they did systematic screening of a sample of the population in every county in the state of Indiana, and that does provide useful public health information. However, for an individual person, having a negative test really is not going to change what you do. And most people do not have antibodies. Even if you have antibodies at this point, all we know is that there was prior exposure to illness, but what we don't know is whether or not antibodies actually protect an individual from risk of future infection. We also do not know whether antibodies protect someone from spreading the virus to others. So when should you be tested? And really the key answer there is whenever you have symptoms concerning of COVID-19. So that's your cough, fever, shortness of breath, muscle pain, chills, those types of things. If you have those upper respiratory illness type symptoms, that's when you should seek further medical attention. And if there is concern, if you're evaluated by a provider and that provider is concerned you might have COVID-19, they are going to order the nasal swab PCR test to evaluate you. The access to testing has really improved. There are now multiple sites available for testing. You have sites available through outpatient clinics and also a number of sites that have been made available through the Indiana State Department of Health and the Allen County Department of Health. And there is a website that you can go to at in.gov to look, and this is updated on a daily basis, that show you all of the testing sites available in your area, hours of operation, and how to schedule an appointment to undergo testing as needed. So let's talk a little bit about that Indiana State Department of Health Fairbanks study. They just released these preliminary results yesterday. They sampled over 4,500 individuals across the state. They did random sampling of people ages 12 and up in every county in our state. And they found that a total of 2.8% of people either had the virus actively or had evidence of prior illness with the virus. So of that 2.8%, 1.7 was people that had a positive nasal swab, meaning that they had active infection at the time they were tested. And then 1.1% had evidence of antibodies, which indicates that they had past infection with COVID-19 at the time the sample was collected. Of the people that had a positive nasal swab, about 45% did not have active symptoms at the time of the nasal swab, and they were positive. So what this tells us is is that there are individuals who are walking around in our community that do not know that they have early infection with COVID-19 because they don't have symptoms. And that is why it is so important that we follow and continue to use our social distancing, hand hygiene, masking in public areas or cloth face coverings, because what we know from this population health prevalence study is that 97% of us Hoosiers have not been exposed, and we need to continue all of these appropriate measures to reduce the risk of infection. The more encouraging news, the mortality rate was under 1% in Indiana based on this prevalence study. However, it's important to note that that mortality rate is about 6 times higher than what we see for seasonal influenza. So it's important to understand that some people that become ill with COVID-19 require hospitalization. Some of them require ICU care, and we have had many Hoosiers that have lost their lives to COVID-19. So this is and remains a very serious pandemic. I'm going to turn things back over to Dina Jackway, our Chief Community and Human Resource Officer.
Thanks, Dr. Board. I think it's really important, as Dr. Board talked about the results of the Fairbanks study. I think one thing is really certain, is that we will continue to need to social distance and protect ourselves for a long time to come. And again, despite Governor Holcomb's announcement that says after July 4th, that things can begin to open up and really begin to see broader activities in the community, without a vaccine for another 12 to 18 months is what's predicted, we're going to see continued social distancing and a lot of things different, how we're experiencing, whether it's work, play, and community for a long time to come. And so we thought we would cover today a little bit more about what you can expect, both when you're returning to work and then also some things to expect as you're engaging in the community. There's a variety of things that are on the screen now, and you may be asked to do one or all of these, and this is really not an exhaustive list. There certainly could be others that we didn't include, but we think it's good to provide with arm you with as much knowledge as you're going back into the workplace. You might be asked to self-monitor for symptoms. Most certainly, if you're not feeling well, you should not come to work. We're doing that here at Parkview. We want to encourage all businesses, make sure that you can be as flexible as possible on attendance, because we know that we don't want people to come that are ill to come to work. We want to keep everyone safe. You might be asked to wear a mask at work and wear gloves, perhaps, depending on what the industry is that you're working in. You may be asked to have your temperature checked or clean your workstation. It could be that now you're cleaning high-touch surfaces on a much more frequent basis. And depending on your job, you may be asked to be doing that multiple times a day. And for those that are working from home right now, here at Parkview, out of our 13,000 coworkers, we have about 4,500 individuals who are working from home and will continue to work from home, even as we head into the next 6-8 months. And as they're doing that, we want to be able to provide as much support as possible, but we know that some of you are working from home and your employers may also ask you to do the same. As you're going into the public and into our communities, and you're going to see a variety of things. And we know that probably one of the most anticipated announcements by the governor was, when can I have a haircut? And that was very exciting news, but some have, yes, gone out and had that haircut, and they probably experienced things a little different than the haircut they may have had a few months back. And others have said, I'm going to wait a few more months and see how this shakes out. Regardless, I think you're going to experience things very differently as you're engaging with businesses, and you might be asked to wear a mask. There may be companies that say, in order for you to come in and be a customer, you have to wear a mask. So make sure that you know those ahead of time so you're not surprised as you get to the door. You may be asked to have your temperature checked. You may need to wait in your car to wait for your appointment time so that there's only very few people who are in the waiting room at any given time or simply taken right back to the room if you're at a spa or another appointment type location. You may be asked to wait in a line so that There's only so many people who can be in the store at any given time, and so they're not able to let everyone in who wants to come at one time. And another final one that we would say is you may be asked to pay for things a little differently. I mean, some are discouraging cash, some are saying, if you can pay for this in advance by doing Venmo or by doing Apple Pay or Samsung Pay or whatever that looks like, being able to do as much contactless pay transactions as possible, we truly believe that businesses will continue to want to do this more and more. And so what you start off seeing may in a few months change because technology is being added and being able to help serve you better. So one question that has come up frequently is, how are we making sure that all of the locations are doing things to help keep you safe? And one thing we can't say is we don't know how every business is going to do it. Now, we've spent the last 2 weeks talking to businesses in our community and helping them shape and guide how they're going to communicate with you as you're entering back into their locations and businesses. But it will look different. And you may be in a position where you don't like how a company is approaching their safety measures, and that's okay. You can choose to leave, you can choose not to. We really believe in the next couple of months, patrons, and as we go into organizations, we're going to look at how safety is being addressed, and we might not like that, and we might choose to go somewhere else to have that same service. We understand that. Also give a little grace and understanding, but above all, your safety is the most important for you and your family. So if there is an organization that you feel it's not quite meeting what your needs are, then you can choose to not continue, and share your feedback with them, that perhaps why you're not going to continue using their services because of these things. But communication is so important, not only to help the organizations understand how they can best protect you, but you being able to share a voice in that. As I shared earlier, caring for yourself and your families through this has looked very different for everyone. And this is a great demonstration of this change curve, and we're all on it, and we're all on it somewhere different. We've all gone through the shock stage. We're going through some denial, going into depression perhaps, just this isn't the same as it's always been, because everything has changed. Everything has shifted. And so we recognize that because individuals are going through this differently, we do believe on the other side of this, there's such great opportunities. The new normal, as we've heard many times that phrase be used, well, there are going to be some great best practices that are going to come out of businesses finding what the new normal is and how they're going to serve you. And that they should maintain. We've encouraged businesses, keep those practices, because those are great ways to continue to engage with the community. But I think really the main point here is making sure you're taking care of yourself and recognizing, give yourself a little grace. Where you are in this phase and on this curve may be different than other individuals you're coming into contact with, and respecting that. We know right now mental health is absolutely paramount. We know that Parkview Behavioral Health and other institutions that are out there, Park Center and others, are really seeing a big increase in community reaching out for resources and services. And so we put on this slide a couple of resources for you. The Parkview Behavioral Health 24-hour helpline is absolutely available. And then the Parkview website. We spend a lot of time talking about blogs and different resources that we can provide you as individuals and families on so many things that touch the mental health aspect, just to help prepare you and be ready. That content is being changed regularly. So please, we invite you to go out, and they may not all be applicable to your situations and your families, but please engage where that is most appropriate for you. And then finally, on this whole caring for your whole person, just a few ideas that we would throw out. It's hard to say limit screen time. I'm guilty of this too. I mean, my children are at home, and digital learning puts them in front of a screen. And then of course they have video games and they have other things going on. And so how can we as individuals, we say limit screen time, but so much of what we're doing right now is online. But being able to step back and seeing where you might add games, brain activities, some Sudoku or puzzles, some meditation. and breathing exercises. We've had quite a few of our own coworkers say, I want to be able to sleep better. I want to be able to take care of myself better, and perhaps going through some breathing techniques and lower anxiety. And so there's a lot of apps out there that are available to me. The Calm app is something that we've heard a lot about. There's plenty of others. If you go out to your app stores and research that, you can find what's going to be the best for you and your family. But it's really important that you find ways to help decompress. And then finally, if you're a believer, now is a great time for prayer and really gaining connection to that spiritual side. So we encourage you to look at that if that is your belief. So now we're going to shift things over again, and we're going to talk to Dr. Mike Knipp, who is our Chief Medical Officer for Parkview Total Health.
Thanks, Tina. Hi, everybody. So I'm Dr. Mike Knipp. I'm a occupational medicine physician, but for our time today, I'm going to put on one of my other hats. I'm also board certified in lifestyle medicine. So I wanted to couch a lot of what we're talking about in how to update and improve and make your lifestyle healthy in this time, because it's an understatement to say that our lifestyle has been greatly impacted by this pandemic. First off, a couple reminders. Control may seem impossible right now in aspects of your life, but you are able to, as you'll see here in the future slides in our Q&A, control some of your space and your safety and be able to make choices to exert control in your daily activities. So we're in this together. It's kind of just a very, very basic part of what it is to be a Hoosier. We, before COVID, cared for our neighbors. During COVID and after COVID, we will continue to care for our neighbors. And it's very true, to put a fine point on it, by caring for somebody else, you know that that is going to be coming back to you, and someone's looking out for you as well. We're all looking out for each other at this time. A special note here, the word vulnerable you may have seen in relation to COVID. So who's more vulnerable for COVID? Now, I wanted to clarify just real briefly, as this is a novel or new virus, we all have a shared equal risk to become infected, but there are going to be certain groups of people that are more likely or vulnerable to have a worse disease course. But in these times when things are disrupted and new processes seem to change every day, we want to highlight some of these groups on here, as you can see. And the bottom point there, it might be you, and it's okay to be vulnerable and reach out virtually, of course, and ask for help if you do need something. It's back to the Hoosier hospitality and looking out for one another. Some practices that have already started and will continue and probably should continue. Many employers going to remote work. Certain things that used to be gathered in person are now virtual, like a book club or a birthday party, or even maybe a rehearsal or something like that. As was mentioned before, online or virtual games with your friends. I am probably an Animal Crossing addict. It's so much fun. I play with my kids. That's a way to keep connecting. There's also Zoom or other games you can do, like the Battleship or scavenger hunts with that. So hand washing. We all probably in kindergarten had a good education on this, and we realized, yes, it is important. Well, when should I wash my hands? Well, here is a really good list of times you should be doing that. An easy rule to remember is, only clean hands should touch food and touch face. And so that is kind of an easy thing to remember. That is a good practice to keep going. And we're going to have here, just for a second, a brief video on how exactly to go ahead and wash properly. So there's that video. I do want to mention you saw 20 seconds in there. How long is 20 seconds? Well, we know that is, but as you probably have realized, or I definitely do, have an internal radio station when I'm washing my hands. There are tons of songs and sites out there to help you choose. Currently stuck on repeat, and I'm sorry for mentioning that, is the Rick Astley classic, Never Gonna Give You Up. One of the choruses is about 20 seconds. I'm sorry. How do we clean surfaces? So there is readily available an EPA list of cleaners that can appropriately take care of coronavirus. The good note there is to also, it needs to sit before wiping or using the surface again. Our instinct is probably to see a wet surface after we sprayed cleaner and wipe it up right away, but these cleaners do need to be able to sit there and set and do their job for us. Masks. So this is another big thing. There's lots of noise out there, and we're trying to give some signal regarding the why, what, when, and how. So not all masks are the same. You may have heard the name N95, but also seen things like a cloth mask or surgical, or even someone wearing a handkerchief or bandana or something. So just real quickly, the right tool for the job is needed. So an N95 is going to protect me from someone else. These really should just be used in healthcare settings where possibly an ill person can't be masked for some reason. Once you're seeing people out in public using, and maybe at work, our cloth masks or a surgical mask, which that is what we were talking about in source control, meaning I'm protecting other people from me. And so the very, very important point at the bottom is masks, especially the cloth ones for source control, they are like traffic laws and signals, and they don't work the best unless everybody is doing them. And another concept we have here at Parkview is the phrase more than a mask, meaning making the environment as safe and healthy as possible. It's more than just using a mask. We'll talk about that a little bit later, but on the traffic and the driving, being safe on the road is more than just a seatbelt, just like being safe out in public is more than a mask right now. All right, so there's a quick video that will be available on our website on how to properly use a mask. So a couple other things. Planning ahead is a good thing to do. What do you need for your house? Cleaning supplies, we've touched on that. The other thing I wanted to really bring a little bit of light to is if someone in your house becomes ill, you probably already have been, last year even, someone was sick with a certain thing, but it's gonna be more important at this point. If they can quarantine or separate, that's great. Everybody has a different home living space, but if there's a spare room or something like that, or a couch, they can kind of use that. And then they're going to be using, if possible, their own personal care items, towels, things like that, and also the same dishes or utensils, possibly needing to switch to a small, brief supply of paper plates, plastic forks, things like that. Something we've talked about and kind of got a little bit more congealed here is what we're calling a ready bag. I often look when we're just going to go to the park with our kids, how many weeks we're going to be gone, judging by how much stuff we have. But it's another thing to be ready. That's control for you, and that control helps you feel empowered as you're going out to keep yourself and your family safe. So we just have a couple things to consider putting in a bag. Of note, with your masks, you should keep them separately in bags inside and separated. Maybe one for you, anybody else that you're going to go out with, and then for your kids as well. And just a couple things to have, as was spoken about by Dina before. Hopefully, if you're going to a restaurant or something, they will be following correct practices. But if they don't, and you'll have gloves, some hand sanitizer you can use on the fly, and things like plastic utensils. And also make sure that your apps are updated and those sorts of things. There is on there, and we'll talk a little bit more, there's the Parkview Business Connect site, which will have some additional resources that we'll talk about here in a little bit. Having said that, I think it's time for some Q&A.
For the presentation today. We will go ahead and jump into some Q&A, and there is a tab down at the bottom of your screen. There's a Q&A tab that if you would like to pull that up and ask any questions, please do so. We have some that were submitted ahead of time, so we'll get started on those, but then please use that Q&A tab to submit anything. Let's talk about proper hygiene methods we need to keep ourselves well. I know you just talked about some of that with the hand washing and masks, but anything else you would like to add in there?
This is Dr. Ward, and as we mentioned, we talked about the importance of hand hygiene and really getting that as a regular habit as part of your daily life. Social distancing is also important. If you're going to wear a mask, making sure you're putting that mask on properly and that it's clean, and that you're just mindful of your surroundings. I think that's one of the things that we need to sort of retool our brain and our behaviors, is being more mindful of our surroundings. So if I go into a store in a public place, I'm not picking up items that I don't need to. I'm only getting the items that I need, and I'm not spending lots of time lingering in the store if I don't need to be there. And also just being mindful of the care of others, particularly, I've got 2 daughters, and when, we want to make sure that they're safe. So we don't take them out on errands if it's not necessary for them to be with us. So simply just thinking differently about how we do things, both as individuals and as families, thinking about those, if you have a loved one who is more vulnerable, what are steps that you can take to help them to be safe and to help them with their needs? So just some thoughts there. And I want to turn it over here to Dr. Nip about some other things to help your immune system.
Thanks, Dr. Ward. So again, this, as you can see there in the bottom, this is from the American College of Lifestyle Medicine. Now, I want to be really clear. This, following these steps have always been a good idea, are a good idea, and will continue to be a good idea. It's not to say if we're following all of these, you can't become infected. It's just to say we're trying to keep our immune system or our team as healthy and as in top shape as we can. The game that they're going to go out on the field and play is going to be a tougher one because they haven't played this opponent before. But still, there are things we can do to keep our immune system in tip-top shape. We've already highlighted a couple of them. Dina did with stress and activities, connectivity, and then quality sleep there as well. And of course, no smoking, especially from the literature. We know many people in other countries, connection between smoking rates and higher levels of morbidity and mortality, because this is can do a lot of damage to the lungs.
Obviously, you mentioned your kids, Dr. Board, and that's one of the questions. How can we care for my kids' well-being right now when there's so many unknowns? They're disconnected from friends. I know I've dealt with that with my own children.
This is Dr. Giaquina. I'm a Parkview pediatrician, and this is actually a question that I'm fielding a lot, both through telemedicine and now that our offices are open. And, we are really fortunate that coronavirus represents, children represent less than 2% of all positive coronavirus cases. And of those that do get it, they mostly get over it. The children's immune system, for whatever reason, seems to be robust in tackling this disease. And we're seeing very few hospital admissions, and more importantly, extremely few cases of very serious infection. However, that doesn't mean that coronavirus is not impacting our children. And the biggest thing that I am seeing in my clinic is parents calling in saying, there's something wrong with my child. I had no idea they were this impulsive. I had no idea that they were this irritable, and they seem to go from 0 to 100 miles per hour, just like that. And they're asking me, Doc, my kid has ADHD and I didn't even know this. And they are really worried that they are acting like this in their school system. And the reality is most likely they are not. And there is a reason for that. And that is, teachers are amazing. Everybody on this call should write this down. Teachers are amazing. And they are extremely well trained at being able to keep your child's attention and focus during class. They understand their needs. They understand their limits to their attention and their impulsivity. And because of that, they don't act out. They do really well. And when I ask the parents, well, how are they doing when they are in school? They're saying, well, they're doing fine. The teachers aren't expressing any concerns in the school system, but this is an entirely different child than I'm used to. And the reason for that is severalfold, but I always point out to teachers or to parents that when they are at home, they aren't their normal parent. They're not parent mom and parent dad. They're working mom and they are working dad, and they're not giving their attention that they normally give when they come home from work, and they're able to not focus on work and their other things. They're trying to juggle all these things, and kids are acting out. We're seeing kids that are more anxious and more impulsive because of that anxiety. And so I really need to work with parents on their expectations and how to try to how to utilize some of the tips that teachers often use to make sure that their kids are reassured and we're controlling and understanding the expectations of their impulsivity. The two big things that I talked about with parents are the 2 R's. One is reassurance, and the second is routine. One thing that teachers are really good at and that kids are used to when they're at school is a routine. So if you don't have a routine on your refrigerator that says we're waking up at this time, we're doing breakfast at this time, we have activities scheduled here, we have free times right here, then you are really doing yourself and your child a big disservice, because they rely on that routine for reassurance and to know what is coming next in the day. And what we're seeing is that kids, when that routine is thrown off, they are acting out and they are frequently more impulsive. A couple of other tips that I give: make sure that we are giving them time ins as much as we are giving them time outs. Teachers are really good at not arguing with children, using quiet voices, and knowing that power struggles are not effective. So they give timeouts. They say, all right, we're going to do a 2-minute timeout. And without explaining to them why they're doing that, they just give two-minute timeouts, and then they come back and they go about their day without increased anxiety or stress. But we need to give children time ins as well and give them our attention. We need to catch them in the good. We need to watch them carefully for doing acts of kindness, acts of concentration, and noticing that and really reassuring them that, boy, you guys are acting wonderfully, because they're not getting that reassurance, I think, that sometimes they're used to. And then finally, we just need to sometimes hug our children more and tell them that everything's going to be okay. A hug will lower a child's heartbeat by 10 beats per minute. And we need to remember to do that. We need to give ourselves grace. We need to know that we are not teachers. We did not get the training that our amazing teachers did give. And so our ability to hold a child's attention and impulsivity might not be perfect, but we're going to do the best we can. And so, gosh, when the next parent-teacher conference comes along, parent-teacher appreciation, or the next time we're able to maybe give a hug to somebody, make sure that that goes out to a teacher, because they are amazing. And this really, this season really, really magnifies how wonderful they are at The last thing that I really need to get to is that we must make sure that our children are coming back to the pediatrician's office. We have missed many exams due to this, mostly due to lack of PPE, which we now have. We've been very innovative about getting your children into our clinics in a safe manner, so that the benefit of coming to that pediatrician's office well outweighs the risk of contracting coronavirus because of the really robust system that we've created to safely see your children. So that means getting caught up on their vaccines. We're really worried about the emergence of vaccine preventable diseases. We're really worried about missing the anxiety and development screens that we give to young children and adolescent children. And most importantly, we're worried about missing things on a comprehensive physical exam. So if your child did miss a visit in the last 2 months, call your pediatrician. The big word is around the state is we are open for business. The word for pediatricians is we are open for children. We need to see your children to make sure that they are growing healthy and that they are safe as they're going along.
Thanks for that. Next question, how can we encourage our friends and family to understand the social courtesy and or need to practice safety measures like social distancing and wearing a mask?
This is Dina. I think the first and foremost is we have to do it ourselves. We have to be, we're all role models and we think about others seeing what we're doing, and walking the talk is first and foremost, but also just offering simply to help. And this comes back to, we've done webinars over the last several weeks to really educate businesses and try and provide tips and ways to help keep the community safe. But you may see something and you might have an idea. You might be able to give them a great suggestion that not only helps address your safety concerns, but also help the business get better at how they're navigating, again, these uncharted waters. I mean, this is, not everyone has all of the answers, and so being able to put that out there. And finally, just being kind and giving a little grace and understanding. Businesses are going through this disruption. You as an individual are going through this disruption. We're all kind of doing this together. Again, we're flying and fixing the plane at the same time. And so just being able to offer that grace is so important.
You know, this kind of ties in with that, with the be kind part. You know, how do we handle being in public when other people aren't following safe guidelines or demonstrating risky behavior?
And so I'll add just a couple of comments here, Dina, again. I think it goes back to my earlier comment, and that was, if you're ever in a situation or your family's in a situation where you feel it's just not safe, that needs to be the first question you're asking all of the time. When you're engaging in a new business or you're engaging in an appointment that you're now doing for the first time, kind of post-COVID and in our new socially distanced world, ask yourself, do you feel safe? Do you feel, call ahead and find out what that company is doing so that you're not surprised when you show up at the door. So it's arm yourself with as much information as possible. And if you do feel unsafe, distance yourself or leave. And then finally, again, as I shared with the last question, tell somebody. If you want to continue to be a patron of that business and you can help them see how you're experiencing it, then the best thing you can give them is the voice, your voice, back to them as a customer.
Here's a good question, because we're just now starting to reopen things. If we're seeing the number of positive cases increase, why are we opening back up?
This is a good question, and it really just kind of highlights the complex and dynamic situation that we're in with the pandemic. And we do know that we have a higher number of total cases, but a lot of that really has to do with broader access to testing. So early on, because we did not have enough capacity to do diagnostic testing, and what I'm talking about is that nasal swab to diagnose people with illness, early on, we only were able to test the most ill people. And as testing capacity and access has expanded, we're testing more and more and more people. So we're identifying people with very mild illness, which I want to remind folks, the majority of people that contract COVID-19 have a mild self-limited course, meaning they don't require hospitalization. They will get better at home with just supportive, routine supportive care. And we're detecting more of those cases. What we have seen, which has been encouraging, is a decline in the number of people hospitalized with COVID-19. We monitor this on a daily basis in every one of our hospitals. We submit data to the Indiana State Department of Health on a daily basis on how many patients with COVID-19 we have in our hospital, and of those, how many require ICU level care. All the other hospitals in the state are doing the same thing, and that's really helping our governments, both locally and on a statewide level, help guide those decisions regarding safe reopening. So we know that we're going to identify more cases early. That helps us with being able to get people into self-isolation if they are positive, to limit spread. And the goal is to continue to monitor that situation using that data, so that we know that if we see a resurgence in cases, particularly hospitalizations, that our local and state government may need to advise us to take additional safety measures to help reduce the rate of spread.
Should we be prepared to hunker down again?
That's a good question. We really don't know how this pandemic is going to progress. We do know from the Indiana State Department of Health Fairbanks study, only 3% of Hoosiers have been exposed to COVID-19. 97% of us are at risk to contract the illness, at least. We don't even know for sure if people that have antibodies are whether or not they're actually immune to reinfection at this point. And we still have a lot to learn about this virus as we go forward. So it's really too early to tell, but I think it's something we have to be prepared that if we have a big resurgence of cases, either on a statewide level or in a specific region, that we may need to take additional measures, and we may need to go back to some things that we were doing previously to help reduce the risk of spread, particularly to vulnerable populations. So we don't yet have a vaccine, we don't have herd immunity, so we are going to see some increase in cases, and it's just a matter of how much of an increase and when.
This has some general information. If you do have additional questions, you can submit those to Parkview in their Business Connect hotline. We'll take a few of the questions we got online here. What precautions should the airlines take so we can fly safely? If the airline doesn't provide precautions, what steps should I take to keep myself safe?
Well, I'll start, and I'll let Dr. Nip add some comments as well. So one thing that's sort of challenging about this is that there's not a single federal standard for the airlines to follow. So the FAA, the Federal Aviation Administration, to my knowledge, has not yet come out with a standard uniform guideline. And so each airline is trying to figure this out based on the size of their aircraft, the configuration of the seating, how many routes, how do they, also, it's not just what you do in the plane, but it's everything from the time you drive in the parking lot to the time you get checked in, board, disembark, and head to your destination. So it's that whole process, not just the time inside the aircraft. And I think, first thing is do I really need to take this trip on an aircraft? That's the number one question. If you actually have to take it, there are not any good alternatives. Do those things within your control to protect yourself. So ask questions. If you purchase a seat with an airline, ask how many people might be on the plane. Am I going to have somebody sitting next to me, or are you going to have that middle row seat empty to help with social distancing? Are people going to be expected to wear a mask? I would certainly hope that most or all people, some airlines are requiring it, but it's not uniform, and it's good to ask that. Meticulous hand hygiene. Airlines are doing all they can in terms of cleaning between flights and things like that. But again, do everything that's within your control to protect yourself. Wear a mask, don't touch your face. If at all possible, don't eat or drink while you're on the flight. Hand sanitizer before, during, and after your plane trip. So take all of those precautions, maintaining social distancing as much as possible. particularly while you're waiting to board your flight and after you disembark, making sure that, if you're handling baggage or other things like that, that you're doing frequent hand hygiene.
Dr. Board, really well said. I just wanted to add one thing that I back to control, and I'll use power. Consumers have a lot of power to choose the airline, to choose a restaurant, to choose a hair salon, to choose a place to shop for groceries. As we know, in the free market, the businesses and companies will respond to consumer demand. So like Dr. Board said, are you calling your airline and saying, are you socially distancing? Are you providing gloves or masks for people flying to wear? Oh, you're not? Okay, well, I'm going to look elsewhere. Well, if enough people say that, or if it's even your local restaurant, we can do, we have a lot of control with where we are choosing to do our dinner out, or if we need to take a flight, how we're going to do it. Are we going to say, oh, an airline that flies out of Dayton or of Detroit actually is doing that, I'm going to drive there. And because I'm going to make that choice, it's a more safe and healthy choice for myself and my family. And it scales down to your decision what department store you're going to go in, or what restaurant you're going to go have a meal at. So we do have, as consumers, a lot of power to drive things the way we want them to be and what we expect.
Yeah, we've heard a lot about contact tracing more recently. Can we talk about any developments there's been and the conversations going along about contact tracing here locally?
Sure. This is Mindy Waldron. I'm the administrator of the Allen County Health Department. And for local health departments currently, a good number of them throughout the state have been doing robust case investigation, which is where we reach out to those who are positive and we work through their isolation needs as well as then who they've been around, and that identifies the contacts. Then we do contact tracing, which is reaching out to all of those that may have been exposed, explaining the risk and the fact that they would need to be in quarantine and how that works, and address any of their needs. We have quite a few resources that we provide locally to all of those folks as needed. However, the Indiana State Department of Health is changing things just a bit over these next few weeks, and all of the local activities will be taken over by the state for case investigations as well as contact tracing. So things will change. It's fluid right now. We want to be hopeful about how that will work, but a lot of the resources and some of the things like work notes and those types of things will not be provided by the state. So we'll have to work through those as we see how this transition works. We also don't allow any cases not to be found. So if a demographic was typed in incorrectly or a phone number is off by a digit, that means we can't reach someone. We find every one of those, and usually within 24 hours. It takes me quite some time each day, but that's what we do. The state will likely not do that, and so we might have just some changes in expectations of what that might look like. So if you receive a call as someone that's being said you are a contact, or if you are indeed a case at some point, it's just important to be able to be ready to explain what your activities have been, who you've been around, the dates of when your symptoms started. All of those things are what they will ask, and then base decision making after that. So we will see how things go, and if there are other resources or documents or processes we need to develop to make sure Allen County citizens get what they need relative to this, we'll do that.
Thanks for that. One of the things, and we talked about the emotions of the pandemic, and we're all going through different things, and we probably all hit highs and lows. Is it normal to have such frequent changing emotions right now?
Question here, and I'm referencing us all back to the slide Dina talked about. What this person's describing is very, very normal. Before I go into that, as putting on my doctor hat here, if anyone is feeling anything where they're having thoughts of self or other harm, they need to speak immediately and get mental health resources. Mental health is sometimes an invisible issue, that it's not like a hurt elbow or something that we can definitely see and know that other people need help with, but it's okay to feel what you're feeling. But I think those cycles, as I'm kind of seeing on the question, I think they're very normal to feel, especially when there's not a facet of life that hasn't been upended and changed. There's the deconditioning term, we kind of know what that means regarding strength and endurance. You know, you haven't been to the gym for a while, you may feel physically deconditioned, but there's also going to be a lot of social, emotional, and mental deconditioning we're all going through. And that will be there coming back to workplace or going out. There's a lot of pent up, I think, hunger for socialization, and trying to navigate that safely and healthy is definitely going to be continuing on in these next months. But again, to reiterate, if anyone is feeling any of those thoughts that are not just the blues or anything, please reach out and get help. There is help for you, and please reach out.
I want to thank everybody for attending today. I want to thank our presenters and the folks that answered questions. I want to thank our partners in this, Greater Fort Wayne Inc., Parkview Health, the Allen County Department of Health, and the Northeast Indiana Regional Partnership. If you have questions still, we're available for that. Please contact us. Parkview has their website up. The GFW staff is available to answer questions, as is the Department of Health. So if you have questions, please let us know. We hope that this information has been valuable for you today, and we thank you for attending.